Welcome, everybody. I'm Steve Chupp. I'm the coordinator for Honoring Choices Indiana North Central. And we help people with advanced directives, which basically helps them answer the question, who would speak for you if you could not speak for yourself in a healthcare crisis? And so tomorrow is National Healthcare Decisions Day, and we are promoting the Advanced Care Directives right here at Center for Hospice Care. And we're discussing with people how to complete their advanced care planning and have a conversation with family members that will help them to be prepared in the event of any particular situation. And today I'm here with Camille, who is a liaison with Center for Hospice Care. And we want to talk a little bit about what advanced care planning involves. So Camille, what brings you here today?
First off, thank you so much for having me. I am very excited to be here and talk about this. My cousin unfortunately had passed away when he was 22 years old. So for me, it's extremely important at any age to have advanced care directives, whether you're 22, 40, any age. And so that's why it's extremely close to my heart. So I wanted to ask you, what is really the difference between advanced care directives and a living will?
That's a great question. And first of all, I want to say I'm sorry to hear about your cousin, but it does point out the importance of having advanced care directives at any age. We encourage everybody over 18 to have advanced care directives. So advanced care directives is kind of a broad title that includes several different kinds of directives, and a living will is one of those. There are two advanced care directives that we especially think are the most important. One is the living will, which basically says, if I'm in a life-threatening situation, would I want a feeding tube or not? The second one, we believe, is probably even more important than that one, and that is a healthcare representative. And that's the one that answers the question, who would speak for you if you could not speak for yourself in a healthcare crisis?
Okay, great. Thank you so much. I now know the difference or how it's all part of it. And what happens is there a huge difference if I'm technically younger or older? What happens if somebody doesn't have an advanced directive in place, and does age play a part in it?
That's a very good question as well. Until a few years ago, it was very difficult in Indiana if you did not have any advanced directives because it was confusing. There was nothing laid out. Now the state of Indiana basically says you can have your guardian speak for you, or a spouse or a family member, and they actually have a hierarchy listed.
Oh.
The only thing is, it may not be the hierarchy that you choose. Okay. And those people may not be in the best position to speak for you. They may not feel comfortable doing that. So we encourage you to find a healthcare representative that you're comfortable with, that can make those kind of decisions, and then you can have the conversation with them about what your wishes would be at end of life.
Okay, great. And is there a big age difference between younger and older when that comes to advanced care planning? Does it get more tricky when you're younger? Or if somebody's been married for, say, 15 years, is it less tricky, or have you seen it kind of all play out in different terms?
Well, that's the beauty of advanced care planning, is that actually it is just as appropriate for an 18-year-old as an 85-year-old. Everybody is going to be basically covering the same questions and getting the same information. There is one difference, though, and that is no matter what age you are, if you have a serious health condition, then you may want to add another form to that called a post form. And that's physician's orders that give the scope of treatment that a person would receive. But otherwise, it's basically the same kind of conversation, getting the same information.
Okay, perfect. And does the doctor have to follow my advanced directives, and whether I'm in the ER or not?
That's another great question, and a lot of people wonder how that's going to work out. So what we encourage you to do, there's two aspects of this. One is the conversation that you actually have with your family members, so they know what you want, and then you document that, and you place those documents with your physician, with your healthcare system, and they are bound to keep those in place and to follow those. And that's why we call this honoring wishes. We want to help you decide what your wishes are, and we do this all at no charge. And then we want to help you decide how you can document that, where you place those, so that your wishes are really honored.
Okay, Perfect. Thank you so much, Steve, for answering my questions, and I really appreciate it.
Well, I'm really glad you came with these great questions. So what we want to do is, at Honoring Choices, is we provide this service to everybody in our area. We provide it free of charge. And if your organization would like to have us come and speak on this topic or present to you, we would be happy to do that, as well as get signups for the actual, what we call facilitations. Any community member can contact us at the email listed and the phone number listed in this in the below, and then we will contact you and set something up for you that will fit for you. We can do that via Zoom or in person if it's appropriate. So thank you very much for joining us today.